Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Tooth Talk, I have Dr. Saravanakumar. To give you a brief introduction about Professor Dr. Saravanakumar, Dr. Saravanakumar received his master's in pedodontics and preventive dentistry from the College of Dental Sciences, India. He was the best outgoing student with a university rank from the Rajiv Gandhi University of Health Sciences, Bangalore. He completed standard proficiency in lasers from IALD, LEI, and UCSF, advanced proficiency from ALD, WCLI, and Manipal University. He has been honored with a Fellow Award, Pedo Master Excellence Award, American Diplomat, and Fellow ICT. Dr. Kumar is a senior consultant at the Chennai Apollo Hospitals. He is one of the first persons to initiate laser assisted pediatric dentistry and has conducted several national workshops and symposiums. He owns India's first exclusive tongue tie clinic in Chennai and his team serving the needy infants and the kids. He's the first pediatric dentist from India to be recognized as a tongue tie specialist and to have been elected as a committee member in the International Association. He served as an adjunct faculty of the UDV Andorra and Dubai. Dr. Saravana Kumar, thank you so much for joining me in today's Tooth Talk conversation with your dentist, and a warm welcome to you. So,
good to be back.
Yes, yes. So, doctor, we have been doing a lot of things in terms of child care, child dental health care, and generally most of this starts after the birth, or once the child has his teeth in the mouth. But do you think there is any effect on the growth and development of a child even during pregnancy? That means when the mother still has the baby in her womb, do you think there are any influences that can affect growth and development in a child?
Yes. As we all know that foundation is very important. Generally, anything that is going to affect the mother health-wise, it's going to affect the fetus. So, like that, even the oral health is also very important. If there is any issue with the mother, either nutrition-wise, normally we know that everyone will take folic acid, folvite. All that kind of supplements is very important when concerned with the oral health also. We know there is some kind of midline. The folic is very important for the brain and the spinal cord development. There is a lot of midline defects which might arise when there is a deficiency of folic acid and other minor nutrients, and vitamin D and other things are very important. And same way, when there is any medications which is taken during pregnancy, that will also affect the structure, orofacial structure. For example, if you take aspirin, other kind of drugs, that leads to cleft lip and palate, and some other deficiency like vitamin B6 and B12 also leads to some craniofacial deformities. So, health, the nutrition and other things during pregnancy is very important.
Okay. Okay. So how exactly do these components affect the growth of the infant? I mean the fetus, doctor. And what exactly are the other defects that can be seen because of these kind of nutritional deficiencies?
Yeah, there is a lot of nutrition deficiencies, as we told. That the reason before they plan, they go and get proper diagnosing, and the gynecologist will guide you to go for all these things. When you consider, for example, calcium is very important for the bone growth and teeth growth. Calcium and other nutrients and other vitamins or all these things or calcified structures are very important when it is considered, when the health of the pregnant mother is considered with that of the fetus. So we tell all the nutrition, whichever it's either minor nutrition or major nutrition, it's definitely going to affect the health of the oral cavity. Either it's a calcified structures or other structures like soft tissue structures, your tongue, your other things like soft tissue will be affected. So it is important for the nutrition. Pregnancy, the oral health is also very important. Normally, we tell before they plan for a baby, we tell to go and take a checkup for the oral health so that the normal streptococcus mutants count of the mother has a chance to transfer the baby. There are a lot of studies done and told the early childhood caries gets lot of mutant streptococci from the mother. That is a vertical transmission. So
Transmission.
oral health of the mother, yeah, vertical transmission. So oral health of the mother is also very important. We can science how to reduce whether the pregnant go to a dental visit or not during pregnancy.
Okay, so Dr. Saravanakumar, what exactly is the time when the baby, when it's still a fetus and it's in the womb? Around what time do the oral structures start developing?
Normally, if you see the stomodium, all the things develop 3 to 4 weeks. By 6 weeks, there will be initiation of the dental development. From the cranial lamina, it will start the enamel organ. From there, it will start. So 6 weeks. That is once after that, the oral structure, everything will start developing. For example, tongue, the palate by 4 to 6. So all the development starts by the first trimester. That is by 1 month to 1.5 months. So we normally when we tell the pregnant woman they go for any or anything. First trimester, we don't tell them to go for any treatment or something else. The reason is there is organogenesis and other things happening in the first trimester, and last trimester is important. We don't want to give unnecessary stress so that there might be premature delivery or something else. So the second trimester is one thing is very safer side for the pregnant mothers to go for the treatment and us. So when we see the oral health, normally they have some things like whether they can go for a dentist at the first trimester or not. Due to the hormonal changes, there is a lot of periodontal problem and gingivitis. Normally we call it a pregnancy tumor
Tumor.
because gingiva gets swollen off and there will be bleeding and other things. So whether they can go for a scaling when they are pregnant or not, it's a very big question. But according to American Academy of Dentistry, their policy is you can go to a dentist for normal cleaning and scaling. The dentist will be able to do a procedure by making the mother in a comfortable position. So going to a dentist is not a nightmare. You can go when you are pregnant, and any emergency treatment at any trimester you can take the treatment. It is not that you should not take at first trimester or last trimester. Proceed during any trimester.
Okay.
This is
Okay.
what is being done by the Academy of Pediatrics.
So Dr. Saravanakumar, at what stage do the teeth actually start developing in the fetus? Around, we know the milk
Yeah,
teeth are the first set that comes, and then the adult teeth start coming at a later date. So does the development of both the milk
correct.
teeth and the adult teeth start in the fetus itself, or how does it go?
Yes, normally the initiation will start by 6 to 8 weeks, and then the progression, maturation, then calcification will happen. All the primary teeth, there is 20 primary teeth. Calcification will happen before the birth itself. That in within few months, calcification will start, and it will get matured. Because after the child is born, by 6 to 8 months, the teeth will start coming. That is like 6 to 1 year. Also, we can tell. Nowadays, we are seeing some kids they don't have teeth even by 1 year. no need to panic. They can wait for till 1 year. You can wait. Normally, we tell it 6 to 8 months, but
8
till
months.
1 year you can keep to erupt. So the calcification, everything will start. For permanent teeth, the first permanent teeth, calcification will get completed before birth. Other teeth, the calcification will start after the birth. That is after 2 to 3 months, after 6 to 8 months, some canines and premolars, and then second molars will get calcification started by 10 to 15. That is the way it will go. And we are more concerned about some kind of drugs which has been given earlier days, like tetracycline, which might cause change in the teeth, permanent teeth and primary teeth. But nowadays, this kind of drugs is not being used often. So to develop before birth, the primary teeth completion of the primary teeth, everything will be mature complete. Permanent teeth calcification starts even after birth.
Even after birth. Yes, yes. So if milk teeth are
Yes.
all formed in the child even before it's born in the fetus stage itself, that means you said first the formation happens. That means the tooth has to form in a soft part, and then calcium gets deposited in it to become the hard part. So, is there any kind of disturbances that happens in this process of the soft part of the tooth forming to before becoming the hard part of the tooth? Can any disturbances in this process cause any kind of a anomaly or a difference in the way the teeth are formed in the child?
Correct. Exactly what you told is a good thing. Anomalies, developmental anomalies is the term what we give. Normally, this developmental might happen due to high temperature, like they have high fever, or sometimes there is a nutrition deficiency, or any local factor, or any kind of infection during the pregnancy. All these things is going to affect the calcification of the primary tooth. So, what all things can happen means there is a different stage of tooth development, initiation, and then progression, then maturation, morpho differentiation, histo differentiation. So, whenever there is a problem during any particular stage, there is different types of anomalies will form. Mostly, like what you have told, when deficiency in nutrition or something like that, you might see hypocalcified or hypomineralized teeth. That is, the tooth will be very brittle.
Brittle.
Tooth, as soon as it comes, it will break, and it is more prone to dental caries, and you will see kids with no teeth. All the teeth will be flattened. So all these kinds of things will happen if there is no sufficient nutrients from the mother
Mother.
for the tooth to form.
Yes. So apart from this kind of disturbances, where the soft part of the tooth before it becomes the hard part, there is any disturbances, or if there is not sufficient calcium probably available in the mother's body, and that is not supplied to the child, there will be disturbances. Other than that, doctor, what is the other kind of disturbances that we can see? Is there some other kind of anomalies that we can find among the children?
That's what actually other things we sometimes will not be able to find the kind of congenital anomalies. Whether sometimes enamel organ itself will not be found. So we call them as dementia, all these things we will not be able to find during the ultrasound during the pregnancy. And sometimes, mostly the cleft lip palate, everything would have been noted down when there is ultrasound down. Small structures, defects like this, or any kind of extra teeth, the supernumerary tooth or something like that, that will not be found until the child is born, and after the growth only we will be able to find. So there is not going to affect the shape of the tooth, size of the tooth and number of the tooth. So all these things will have different stages of the tooth development. It is affecting.
Okay. So doctor, sometimes what happens is the child is born only with some teeth in the mouth. What exactly are these?
Yeah, we panic when the mother sees a small uh, white color part or hard structure which is in the jaws, and it is a teeth, and it might interfere with the feeding, or the mother will have a fear that the tooth is going to get aspirated or something. And during birth is called natal teeth. So at the time of birth, if mother is seeing there is a tooth or the doctor is seeing, it is natal teeth. Any tooth which within 30 days, within 30 days it is called neonatal tooth. So any teeth if they come in 30 days, it is called neonatal tooth. And any tooth which is going to erupt after 3 months or 6 months, early infant teeth will go. 6 months onwards, it's a normal tooth.
Normal tooth.
So what is the concern when there is a natal teeth or neonatal teeth is when the teeth is going to affect the breastfeeding, it is
Feed.
better to smoothen the tooth. If it is more mobile, if it is more mobile and the parent is thinking it is going to get aspirated inside, it is better to remove it.
Remove it.
90% of this teeth is 90% of this teeth is primary tooth, which is placed high up in the dental lamina. So 90% this tooth which is being removed as a natal teeth, so they will not have any primary teeth, anterior teeth, because that is the tooth which has come early.
Early.
So this is a normal understanding.
Yes, yes. So that means to say, Dr. Saravanakumar, that a mother's diet and nutrition and her diet habits and her health condition play a major role even in the growth and development of the entire face and the teeth and the jaws of the growing fetus.
Yes, exactly,
So,
definitely.
so
So all that is important. You yeah.
So it is important that the pregnant mother maintains her health well, and also, like you said, probably in the second trimester, she can visit the dentist if there is any emergency that's required to be done. Get it treated so that she becomes comfortable, and in the later date, when the teeth are maturing, there'll be no problems in the process.
Yes, exactly. That's what we used to tell them before they plan for a baby. Go to a dentist, check all the teeth, clean everything. Any
Yep.
impacted tooth, it's better to remove.
Yes.
Any root canal, you get it done. All
Yes.
these things, because after they become pregnant, it's a lot of different scenario where it will be
Yes.
to
Yes.
lie down. All things are there. So it is, and streptococcus mutants count will reduce with a good oral. So the important thing we are considered. Some children, some parents will tell them to chew xylitol chewing gum. This is one protocol proposed by AAPD, American Academy of Dentists. Xylitol chewing gum, it will and it will reduce the streptococcus mutants. We tell them to take 2 to 3 in a day, so that this is going to increase the saliva and reduce the streptococcus mutants count in the parents. And other ways to reduce the streptococcus mutants in the pregnant mother is 0.05% fluoride varnish mouthwash, or you can take 0.12% fluoride wash to the streptococcus.
Yes, yes.
Yes.
So I think apart from even the Streptococcus mutans, the one bacteria that causes tooth decay, I think also there have been confirmatory studies that have shown that even gum infections in the mother can lead to low birth weight in
Yes.
the child.
Yes.
Yes.
Yes. There
So
are different studies like what you said. Yeah. Tell me.
yeah, so I think it becomes really important that mothers take care of their health. In fact, I think they should plan their oral health even before they plan a pregnancy, so that any other conditions in the mother's mouth that can lead to an emergency during the pregnancy is taken care of before itself, so that she can maintain good oral hygiene and also good nutrition to provide the right nutrition for the growing infant.
Right. Rightly said. During that time, even sometimes there is a chance of low weight baby because of gingivitis during pregnancy. So we tell them to take care,
Yes.
and they have gingivitis during pregnancy might even lead to
Okay.
yeah, that is what they have.
So, Dr. Saravanakumar, thank you so much. That was a very informative talk on how care during pregnancy is important to maintain proper oral health in the child in his future years. That is after childbirth. That was very informative indeed.
Yeah, yeah, that's very important.
Thank you. So, thank you so much for joining me today in this talk with me. And I hope I can get you back again to do a talk on another topic on the dental health care of children. Thank you so much.
Definitely. Thank you.
So, viewers, that was Dr. Saravanakumar who did join us in today's conversation to tell us about the importance of oral health in the mother, which helps her maintain a good general health so that the developing fetus gets proper diet and nutrition and proper facial development and teeth development. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. For more information about your oral and dental health, visit our website www.thedentaire.com. And until next time that I come back with another dentist with another topic on your oral and dental health, keep smiling, stay safe, and be happy. Thank you.